What is holistic wellness? Holistic's being used a lot, but what does it really mean here at La Chalet? Years ago, I really started to study more functional medicine and really studying the word of what it means to holistically care for somebody. And what that really means is that you're not looking myopically at just like a wrinkle, but really asking, why is the skin behaving the way it is? Is it something internal? Is it your hormones? Is someone premenopausal, menopausal, post? Is a man's testosterone dropping? Was it lifestyle factors? Has it been childbirth? Has it been weight gain? Is it insulin resistance? All of those things internally affect you externally. And to just look at the skin externally and not ask what's going on inside the body that's leading to the inflammation of the skin, that's leading to these other skin disorders or how you're aging, is really bad medicine. You really have to look holistically at the person and analyze all that. And I'm really proud here at La Chalet that we have all of these wellness divisions. We're currently expanding upon that on different ways to not only live longer and improve longevity in the sense of living healthier, but really holistically, when you walk through the door at La Chalet and you see a medical provider, that person then understands that the handoff to one of our medical providers who specializes in hormone therapy, one of our team in our weight loss division, and that's an incredible division. These drugs, these GLPs, Ozempics, they're changing the world. 22% of Americans in 2024 tried one. What's that number going to look like in 2030? And so we really started at the beginning of that wave, and our team of brilliant obesity specialists have navigated it where we're able to work with insurance companies, we're able to work within everybody to find that right medication, and really it's changing so quickly. The medications that we were using 5 years ago are very different than what we're using today. So bringing it back, what is holistic medicine here at La Chalet? It's us being able to look at you. We're just not someplace that just does Botox, or we're just gonna fill your lip, or we're just gonna give you a facial. We are going to look at you and give you this comprehensive consultation that will be able to tell you when you come in for a little abdominal fat that we offer more than just liposuction, cool sculpting, but endo lift, but actually treating yourself. And maybe you start in our weight loss division and treating internally, checking lab values, putting you on an in-body scale to really look at what is your visceral fat versus external fat. And then bringing you back then to our medical spa, where we can then treat those skin conditions. Maybe it's really lasers you need, no injectables. So we're really looking at your face and your health holistically in one piece. So how do I stay at the forefront of technology and what the future of regenerative medicine and aesthetic medicine is? It's a lot. I read a lot. I'm obsessed with reading, and I think it's also the partnership with industry. As a key opinion leader and being in the field for 20 years, I just have a lot of amazing colleagues I can call up from around the world at any moment. And just like in any industry, I imagine, where a product or a laser might hit Canada first or the UK or anywhere, and the fact that I have so many great resources among research and scientists around the world. And I do have a third job, and a lot of that is a lot of my consulting that I do, and a lot of conferences and faculty, and really surrounding myself with the leaders of what is next. And I think that crystal ball of trying to be part of it to make sure that we're headed in a direction that's safe. Sometimes things come out that are really, really exciting, and you just want to, it just seems like the holy nugget of never aging, but you really have to still reel it back in and say, Where's the clinical evidence? Where's the studies? And so it's the commitment of working together with industry, laser scientists, research and development teams, pharmaceutical companies, and energy device companies of really trying to figure out what are the unmet needs in aesthetics and how do we meet those needs safely and ethically. There's a lot of influencers that have 30-second influence. That's never really been my goal. My goal has always been to be an influencer for the future of aesthetics, the future of the industry, and the future of where this field will go and I'm proud of where it came from 20 years to where it is now. For someone considering Lachelet for the first time, if I had to say anything about us, it's that we're different. And I don't like being normal. I like to be an outlier. And we're always striving to do things just better than the rest. Whether it's when you walk through the front door and it's the customer service, whether it's the product on the shelves, all have a clinical story, a clinical study behind them. Whether it's walking into a room and that device that's being recommended for you has evidence based that it's actually going to do something, it's not snake oil. And that the product that you're having in your face is one that has a lot of clinical studies. It's not the just next me to Botox that has 0 studies and is just going on the backs of companies like Dysport or Botox who actually did studies. And so the world's trying to get cheaper, which I understand because everything's crazy, but I feel that at Lachelet you're really able to get value at the same time, safety at the same time. You are getting the best products and you are getting it from the most educated clinical team, from the person that answers the phone to the esthetician who is performing that medical facial, to our incredible injectors who are creating art with your face in the way you inject, and to our functional and wellness team who are treating you from the inside out, from your perimenopausal symptoms to testosterone to weight loss. And so I think that's why you should come and visit us. Lachelet for me is a sanctuary. It's my sanctuary. I want it to be a sanctuary for my patients, a place where they can come and feel pampered and loved, a sense of community of like-minded people. And I think that's what we strive to do, is that it is that place that with all the chaos in the world, all the stress at home, that you can go somewhere, feel safe, and feel that you are taking care of yourself. My hope and vision for the future of Lachelet is to continue to advance the blend of natural results that are more efficacious, that treatments that have even closer to surgical outcomes, to decrease downtime. And I think that we never sit still here. I think one of my superpowers is never getting comfortable. I'm ready to pivot at any moment. I know what's coming down the pipeline, and when it comes, I'm able to pivot. So a common question we get every day when someone sits down in my chair is, what's new? I know you guys have something new, because we do. We constantly have one of the next, the future of something, and one single device can really change the way someone ages over the next 5 to 10 years. So right now we have a couple new really exciting energy devices that I think are probably some of the best advancements we've seen towards aging, non-surgically, very little downtime. We're actually now playing with lasers like ExoMind that are about mental wellness. If you would have said 20 years ago when I was in the laser lab at UCLA that we would have, a treatment targeting emotional well-being, That's different. Now, is that the future of aesthetics? Is it that it's a place of wellness? That your touch-based person is not just treating your face, but they're treating your hormones, they're treating your weight, they're treating your mind, and that's a possibility. I don't really know, but it seems to be trending in that way.